Welcome back to Talk 1260 KTRC. You're listening to Western Medicine, the Humanity Behind the Vanity, show about plastic surgery.
Sponsored by Artifil.
Yes.
Thank you. All right, so we're going to introduce a new segment this week. We are inundated with your emails, and we love every single one of them, so keep them coming, please. But a way to address more quickly is to do a new segment, which is going to be our email of the week.
Okay.
So you can look for that every single week, and then you can tune in or have whoever you want to send a question in and tune in to see if their question gets read.
Mm-hmm.
And then we'll continue to do those full segments on multiple questions. But every week we're going to single out one excellent question. So here's our question this week. I am a petite woman with a natural A cup. I am small boned. I would really like really large breasts. What size implants do you think my body could hold? Basically, what's the biggest I could go? From Sharon.
Okay, that's a great question. The problem with putting in implants...
It's a funny question. It's cute. Okay.
Okay. The problem with putting in implants that are too large is that there's a higher incidence of complications. And what are those? Number one, the implant can get a contracture, which means about 8 months later, on average, the soft capsule around the implant, which forms, can turn into a scar. It can turn into a scar, and it can deform the breast and cause pain. That doesn't happen that often, but it can happen.
Yeah.
Especially when they're too big. Number one. Number two, the incidence of infection is higher. And number three, the incidence of rippling is higher.
Oh, yes.
So you can really feel the implant and it looks weird.
What about the incision healing itself?
Sure, if you can imagine, if there's a great stretching of the incision, it can pop open and then the implant gets infected, and that is a disaster. That's a disaster, actually. So there has been a great study done on about 10,000 people, measuring the anatomical relationships between the chest and the breast tissue and the nipple, and I take about 5 measurements, and that goes into a formula, and it tells me, bing, pops out what's the largest implant that patient could have to be in the minimal complication category. And if they want to go more than that, then I counsel them and I say, okay, you can go a little bit bigger than that. You may have a slightly increased risk of complications. I won't go overboard, I won't go crazy, but yes, you can stretch the limit a little bit. Most people here in Santa Fe, which is sort of an earthy, natural town, choose to stay within natural limits.
What about Albuquerque?
Albuquerque's less, no,
people, right? Okay.
And in Texas, for example, it's very funny. There's a study done. What is the average implant size in the United States? In New York, it's 200 cc's.
Well, that's little.
Yeah, in California, it's about 300 cc's, and in Texas, it's 400 cc's.
Really?
Yes. And
they still do it big and better in Texas.
That's interesting.
Okay. So, okay. I would have thought that the biggest CC would have been in California, because you see these typical blonde, large-breasted, tiny women like Pamela Anderson, for example.
Hollywood. That's Hollywood.
Okay, it's not.
That's why. That's not the typical California. Okay. And I may not be right about those numbers, but the ratios are correct. New York is the smallest.
Very
Texas is the biggest.
Yeah.
And personally, I just think it's much safer and it looks much more natural to do it in a way that's anatomically correct, which is why I spend a lot of time with the implants. With the measurements, there are plastic surgeons out there who decide for themselves what size implant the patient's going to have, and they don't give their patient a choice.
We know someone who that happened to, and she was physically miserable for about 9 years, and sort of felt, rightfully so, violated.
Yeah, I see that a lot.
It's disgusting. Disgusting.
So at least I have a whole bunch of sizers in my office where patients try on the different sizes, and then I tell them, okay, that's okay, or that's not okay, or let's talk a little bit about this.
Yeah, I mean, you don't want to go to a chauvinistic male plastic surgeon.
Who are we to decide, what somebody wants?
Right,
They have to
you're
decide
not.
themselves.
It's your body, your breast, your life, your back.
Exactly.
Please. If there's some doctor who's, got the right price, or you think he's cute or whatever, but he's being really chauvinistic and telling you what size to go, run fast out the door.
Yeah, unless he's telling you or she's telling you to go smaller than what you want, then
that's different. Right.
Then they have your interests in mind.
Right, I'm sorry. Yeah.
So to answer your question, Sharon, 300 cc's may be appropriate for you. You got to go in and get your measurements. Talk to your surgeon about whether you want to put it above or below the muscle. I think it's safer below the muscle, especially when you're going high side. And you just need to make an informed decision. You need to speak to somebody who will give you the statistics about what you're facing, so you can decide for yourself.
Well, good luck with that, Sharon. I bet you're going to look great no matter what size you get. So, what's going on? You mentioned something just as we walked in the door here about some goodwill effort you're doing, which I always love. So pray tell.
This is awesome. There's a young woman in her 30s who had a mastectomy a couple of years ago and radiation, and she needs a breast reconstruction, and she needs a big deal. She cannot have an implant because of the radiation, and so she needs what's called a tram flap, which is when you take the muscle.
I am very familiar with those from your residency. Yes, that's a big operation.
It keeps us away in the hospital for a long time.
Yeah,
anyway, she doesn't have insurance, so I've been able to arrange for the anesthesiologist to do it for free, the OR to do it for free, and the hospital to do it for free.
Which hospital is this?
At St. Vincent Hospital.
Excellent.
So, Dr. Mulliken and his group at St. Vincent are going to do it for free. I'm going to do it for free. And
who's the anesthesiologist?
Dr. Mulliken.
Oh, okay.
Is the head of the group. Right, he's the head of the group. And I don't know if he's going to do the surgery,
but his group has donated their time. Oh, that's great.
Which is nice. And the Christus St. Vincent Hospital, Paul Generali.
Yes, Paul Generali.
Yeah,
he's the man.
He's going to donate the.
He knows what's right. Okay.
Yeah, and so this is a young woman she's got a daughter who's 5 years old who is looking to her as she grows up, and so it would be nice for her mother to have.
Right. This is this young woman's personal choice. There are many women who go without. Right. Again, that's incredibly personal. We have no opinion on that.
Right, absolutely. And so, she's young and healthy, so I think she's going to do great.
Oh, she'll do great.
Yeah.
And, is she going to be in pain, though, for that tram?
I don't know. We use a pain buster. Actually, there's a great company called iFlow, which makes the OnQ pain buster. And it's a balloon full of anesthetic, and it shoots in anesthetic right into the site of surgery. And the studies show that people use fewer narcotics. We're going to be talking about that again on another show, because that's a really important
that's a big deal.
thing.
So that's great. Did this woman come to you, or did she come to the hospital?
No, she came to me.
Oh, so you got this whole goodwill effort going. That's
excellent. You and I started, actually, this breast reconstruction fund.
Oh, she came to our fund?
Yeah.
Oh, excellent.
It's through the Santa Fe Community Foundation, and so because we started this fund because there are just so many uninsured women in northern New Mexico. It's one of the highest regions in the country, and
region in the country of what? Uninsured women or breast cancer?
Of uninsured, breast cancer, uninsured, and so there's just a need for it. So she's going to get taken care of, and I think she'll be very grateful, and I'm grateful to the hospital and the anesthesia group for donating their time.
All of you, that's really, really wonderful.
Yeah, it'll be nice.
And you can always donate to our Breast Reconstruction Fund. It's the Daniel and Elizabeth Ronel Breast Reconstruction Fund through Santa Fe Community Foundation. I do not know the website off the top of my head, but all that money that you send in, have sent in,
is tax deductible.
Fully tax deductible, and it's helping these women like this young lady.
Right, and you can find that on my website, www.danielronelmd.com, in the philanthropy section. You've been listening to Talk 1260 KTRC, Western Medicine, the Humanity Behind the Vanity.
Thank you so much for listening. We love hearing from you. We love doing this show. Keep your emails coming, and we will talk to you next week. Have a great week.